Hello everyone, welcome to sqadia.com and let's start with the first section of our lecture topic, chronic pelvic infection. In this section, we will talk about the pathology, clinical features, investigations and management of chronic pelvic infections. First thing we should know is what's chronic infection. A chronic infection is the infection that's present for a long time, for long duration. The other term you should know as compared to chronic is acute. Acute is something which is short term, short duration. So chronic infections are present for a very long time and they are really very devastating for the patient. So a distressing clinical entity not only to the patient but also to the physician because it's chronic, long duration. Patients keep on coming to the doctor and keep telling them they are not getting better. So it's really, really stressful for the physician also because patient is not getting better or not getting any improvement. So chronic pelvic infection, what are the some associated features of chronic pelvic infection? Usually the chronic pelvic infection is following the acute pelvic infection. So if acute infection is present and patient usually neglects it or doesn't pay attention and doesn't see the doctor and they don't get treatment properly, it becomes chronic. So usually chronic infections are accompanied by the acute pelvic infections, or they may be following low-grade recurrent infections. Usually, if there is low-grade recurrent infections, they later on become chronic. Or one example of chronic pelvic infection is tubercular infection. Tuberculosis is infection that not only involves the lungs, although lungs are the primary site of tubercular infection, but it can involve the other organs slowly. So tubercular infection is a common example of chronic pelvic infection. This is the diagram that gives the, again, female reproductive organs, vagina, then there is cervix, and the myometrium. Myometrium is the middle muscle layer of the uterus. Endometrium is the inner layer of the uterus. So this is the endometrium, inner lining of the uterus, and then myo is the muscle and myometrium is the muscle layer of the uterus. These are the fallopian tubes and the ovary. So ovary, where the ova is produced, from the ovary, ova goes to fallopian tube and then it comes into the uterus. So this is all the organs that constitute the female reproductive system. So chronic pelvic infections are the infections that last or that are for the longer duration. Usually acute infections can become chronic infections if they are not treated properly. If there is recurrence of infections, suppose if it gets better and there is recurrence again, it can slowly lead to chronic pelvic infection. And then one common example of chronic pelvic infection is tubercular infection. So, pyogenic pathology. What is pathology? Pathology is the abnormality. Physiology is the normal functioning and normal structure of the body system. And pathology is the abnormality. So, pyo is pus, pyogenic pathology. So, what leads to the infections, chronic infections? leading to pus formation. So mainly is there is periodic shedding of the endometrium from the uterus during the menstruation. That regular shedding of the endometrium is one cause of prevention of infection, because regular shedding of the endometrium leads to the shedding of the microorganisms also. And during the some changes in the fallopian tubes, like epithelium is lost during the infections. The wall of the fallopian tubes gets very thick, and there is hydrosalpinx, means a formation of pus or accumulation of fluid. Hydro is fluid. Salpinx is the term used for the fallopian tubes. So hydrosalpinx is the fluid or in the fallopian tube. Or sometimes there is fibrosis also. Fibrosis is the normal tissue is replaced by the fibrous tissue, and it cause the hardening of the structure. So it becomes fibrosis. Here, this is the histological picture of the endometrium. Here, all these changes are taking place in the endometrium of the uterus. Next, what are some clinical features associated with the chronic infections? It may be asymptomatic or symptomatic. Asymptomatic, A means absence. Asymptomatic is absence of the symptoms. And symptomatic, when symptoms are present. Symptoms are the complaints which patients tell you, symptoms. Signs are the complaints which you see in the patient. So symptoms, what patients tell the doctor. Signs are what doctor sees in the patient. So patient might be asymptomatic, means no symptoms. When there is asymptomatic, usually there is a previous history of infections after childbirth or abortion. There may be recurrent episodes of reinfection is often present. So if patient is asymptomatic, the doctor or physician suspects that it might be chronic infection because there is history of previous pelvic infections due to childbirth or abortion, or there may be history of recurrent pelvic infections. When the patient presents with symptoms, the symptoms are menorrhagia or polymenorrhea. Here, polymenorrhea or menorrhagia. Menorrhagia is excessive menstrual bleeding. When there is lot of menstrual bleeding, that's menorrhagia. Polymenorrhea is frequent menstrual cycle. Poly means frequent or excessive. Polymenorrhea. One of the common, you can say, complication of pelvic infection is infertility. Patients comes with infertility, and when different tests are performed, usually it's patients say usually there is a history of chronic pelvic infection. Infertility in chronic pelvic infection occurs mainly due to scar formation, thickening of the fallopian tubes, hardening of the fallopian tube, adhesions formation also. And with this adhesion formation, what happens is there is a blockage of the movement of the ova through the fallopian tube. So this usually leads to infertility or failure to conceive. So menorrhagia, excessive menstruation or excessive blood flow. Polymenorrhea, increase in the number of menstruation. Maybe there is every 15 days, every 20 days the patient menstruate. So this is polymenorrhea. Then dyspareunia is also very common after chronic pelvic infection. It is the painful. This is difficult or painful intercourse. Dyspareunia. This is difficult. It's good to know word parts. Sometimes it makes to understand the word very easy and simple. So this means difficult. Poly means excessive. Mono is one. Bi is two. Tri is three. Similarly, poly means it's more than excessive, more than 4 or 5 or more than 3. So polymenorrhea. Then patients complain of lower abdominal pain, very common lower abdominal pain. There is pelvic pain of varying magnitude. Sometimes patient complain mild pain, sometimes very severe. Then there is congestive dysmenorrhea. Dysmenorrhea again, like dyspareunia. Dys is difficult. Menorrhea is for menstruation. So dysmenorrhea is difficult menstruation, painful menstruation. Congestive is due to increased blood flow, increased blood supply. Then there is also vaginal discharge in case of chronic pelvic infection. Usually the discharge is foul smelling also. So there is vaginal discharge. So these are the symptoms that patient with chronic pelvic infection usually presents with. So we have infertility, there is dyspareunia, there is dysmenorrhea, menorrhagia, there is polymenorrhea. Sometimes there is foul smelling menstrual flow also in case of chronic pelvic infections besides the vaginal discharge. So it's also very common in chronic pelvic infections. Next up is what are some common factors that leads to infertility. Infertility is inability to conceive. So some factors that are that leads to infertility as a result of chronic pelvic infection is the cornual block. Cornua is the portion where the fallopian tubes come and attach to the uterus. So cornea is the point where the attachment between the uterus and fallopian tubes takes place. So when that is blocked, it's called the corneal block due to again adhesion, scarring. When the cornua is blocked, then the ova cannot enter from fallopian tube into the uterus, and that cannot embedding of the fertilized ovum cannot take place, and this can lead to infertility. Then again, next common cause of infertility is loss of cilia. Cilia are lost. Cilia are hair-like projections, and that can and due to movement of these cilia, ova move towards the uterus from the fallopian tube. When there is loss of the cilia, there is no forcing of the ovum from the fallopian tube into the uterus. So that can lead to infertility also. Then another third factor is there is loss of peristalsis due to thickening of tubal wall, closure of the abdominal osseous. So third main reason is loss of peristalsis. Now, what is peristalsis? Peristalsis are the wave-like motions that takes place in the fallopian tube. Again, that helps in the pushing of the ovum. So when that is lost, there is no pushing of the ovum or movement of the ovum across the fallopian tube. So there is loss of peristalsis also. Then fourth common reason for infertility is there is distortion of the tube due to peritubal adhesions. Adhesions are present that leads to the distortion of the shape of the fallopian tube, and this can also lead to the infertility. So the four main cause of infertility as a result of chronic pelvic infection is, one is the corneal block. Cornea is the portion where the fallopian tube attaches to the uterus. So corneal block, there is loss of cilia, which are hair-like projections, loss of peristalsis, which are the wave-like motions that push the ovum towards the uterus, and then there is distortion of the normal shape of the fallopian tube as a result of peri. Peri means around. Around the tube there is adhesion formation, and that can lead to the scarring of the fallopian tube, and that can lead to infertility. In this X-ray, you can see there is different narrowing and adhesion formations that can lead to the infertility. Next, during the examination of the patient who complain of chronic pelvic infection, examination can be done per abdomen, means from the abdomen, and per vaginum through the vagina by the bimanual examination. Usually these two fingers are used to do the bimanual pelvic exam. One hand is on top of the abdomen, two fingers are inserted, and the structures are pushed down through the abdomen. So that pushing down can push the uterus, cervix little down, so doctor can easily palpate through the vagina. So this is the per vaginal. This is called the bimanual vaginal PV exam, per vaginal bimanual vaginal examination. Organs are pushed down and two fingers are inserted into the vagina. Here, this is the uterus, and then two fingers are inserted. One hand is used to push the structures down. And per vaginum, some patients complain of mild pain or discomfort, some moderate or severe. So these symptoms, again, the per vaginal examination, it can be mild, moderate or severe, and there are sometimes violent strings formation. These are the strings or bands are leads to adhesions, very common in chlamydia infection and in gonorrhea infection. So these are common in the infections caused by chlamydia and gonorrhea. And on the abdominal examination, usually patients there is tenderness on one or both iliac fossa. Iliac fossa are these right and left. So there on one or both iliac fossa, and there might be mass felt on the abdominal examination. So right iliac fossa on the right side, left iliac fossa on the left, and when the patient is examined from the abdomen, usually for palpation, use these four fingers, and when you push on the right iliac fossa and on the left, there is usually tenderness on both sides. And sometimes you feel a small mass also. This mass in case of chronic infections is usually due to the scarring and adhesion formation. So tenderness. Tenderness is feeling of pain during palpation. The involvement of the parametrium and uterometrium sacral ligaments are better assessed rectally. So besides two examinations which are through abdomen and through vagina, rectal examination can also be performed, especially when there is involvement of parametrium and uterosacral ligaments are examined, better assessed rectally. And for rectal examination, usually this finger is used, the index finger. Index finger is used to examine the patient rectally, lubricate the finger, and the best position for examining the patient rectally is known as the lateral or Sims position. And in this, patient is on the left side with left leg straight and right leg bending. So that's the position used for the rectal exam. Para means around, parametrium around the uterus, parametrium, and utero is for uterus and sacral is for the sacrum. So this ligament extends between the sacral bone and the uterus. So they are better assessed rectally. Investigations done for the examination of chronic pelvic infection is usually we have blood examination, urine examination, and then the laparoscopy. Laparoscopy comes under the surgical investigations. It's a procedure. So blood examination, urine examination, and then laparoscopy. In the blood examination, the test done is leukocytosis. Leuko is for white blood cells, white blood cells, cytosis. So leukocytosis, usually there is excess of white blood cell count. And white blood cell count are the cells, white blood cells are usually responsible for fighting the infection. So when there is infection present, the white blood cell count is increased. Hemoglobin estimation. Hemoglobin should be measured because in chronic infections usually leads to pallor and weakness, and most likely patients have low hemoglobin level. And then ESR. ESR stands for erythrocyte sedimentation rate. Erythrocyte sedimentation rate. Erythrocytes are the red blood cell. Sedimentation is the rate at which they settle down at the bottom of the tube. In this, the blood is collected in the tube and the time is noted at which the red blood cells are settled to the bottom of the tube. So ESR. ESR is usually raised in infections also. Then urine examination can be routine urinalysis. Routine urinalysis, the urine is collected in the urine cup and then usually midstream specimen, and then it is tested by the urine dipstick method, in which can give the rough idea that patient might have infection if the white blood cell count is elevated. So that's the routine urinalysis. And then in some cases culture sensitivity test is done, in which the organism causing the infection is actually grown, and then we can actually find out the causative organism, so specific treatment can be started. Laparoscopy can also be done depending on what's the extent of the lesion, and then this can give the direct view of the structures inside or abnormality inside. So depending on what's the extent of the lesions, laparoscopy can be performed. Other diagnostic laparotomy. Diagnostic laparotomy is the opening of the abdomen, otomy, opening. Lepro is for the abdomen. In this, abdomen is open to find out if there is any abnormality of the reproductive organs, or in this case sometimes a biopsy can be done if there is some abnormality found, or if there is any lesions or things like that. So these comes laparoscopy, depending on the extent of lesions, in which the instrument laparoscope is inserted inside to find out what are the different abnormalities present. And in diagnostic laparotomy, abdomen is open and then the organs are directly visualized. Now, the management of the chronic pelvic infection. Management is divided roughly into three parts. One is the general management of the patient, then specific, and then surgical management of the patient, depending on the condition of the patient. If there is, in general management, if there is anemia, or patient is pale, weak, doesn't have any energy to move or walk, or just lying here and there, usually patient has anemia in that case. So anemia is low level of hemoglobin or red blood cells. So they should be treated by giving iron, or sometimes blood transfusions may be required. Analgesics are required if patient complains of pain or tenderness. If there is usually the specific treatment of chronic pelvic infection consists of removal of any intrauterine contraceptive device. If chronic pelvic infections is due to IUDs, those should be removed, and then antibiotic treatment should be started. In surgery, as we mentioned in the previously, that surgical procedures for chronic pelvic infections can be laparoscopy, which can tell in which we can visualize the uterus, and it can be, if there is any abnormality or problem, we can see the uterus or fallopian tubes through the laparoscope. But in laparotomy, if more wide assessment of the patient is required, then laparotomy can be performed, in which a cut is given through abdomen, and then directly inside the abdomen, all the reproductive organs can be visualized. So this is the management plan of the patient for chronic pelvic infection. So that was all about the management and presentation of the chronic pelvic infection. So thank you for watching sqadia.com.